13. Tips how to get rid of hiccups. Hiccups occur when you spasm involuntarily from your diaphragm. Your diaphragm is a large muscle that can assist in and out of your breath. You suddenly inhale when it spasms and snap your vocal strings, making a distinctive sound. Number 1. Drink ice water. The vagus nerve can be stimulated by drinking ice water. It is possible to stop hiccups slowly sipping cold water. 30 seconds of gargle ice water. As required, repeat. Number 2. Drink from the opposite side of the glass. Try drinking water from the rear of the glass. Tip your glass to drink from the far side under your chin. Drink slowly and without breathing, a glass of warm water. Number 3. Drink slowly and without breathing, a glass of warm water. Take a glass of cold water and cover it with a paper towel or cloth. Snack it, then. Number 4. Suck on an ice cube. Take ice cube and suck for a few minutes on an ice cube. Then, when it shrinks into a reasonable size, swallow the ice cube. Number 5. Eat a spoonful of honey or peanut butter. Take honey or peanut butter spoonful. Let it dissolve a bit before swallowing into your mouth. Number 6. Eat some sugar. Put on your tongue a pink granulated sugar and let it sit 5 to 10 minutes, then swallow. Number 7. Suck a lemon. Add some salt to a slice of lemon. Sweat and rinse your mouth with water so that your teeth are protected against citric acid. Number 8. Practice measured breathing. Measure your breathing. Breathe in for a count of 5 and out for a count of 5. Inhale a large gulp of air and hold it for about 10 to 20 seconds, then breathe out slowly. Repeat as necessary. Number 9. Breathe in the paper bag. Place your mouth and nose with a paper lunch bag. Breathe in and out slowly, deflate and swell your bag. Do not use plastic bag. Do not use plastic bag. Number 10. Hug your knees. Sit down in a convenient place, hug your knees. Bring the knees to the chest and keep them 2 minutes there. Number 11. Tap or rub the back of your neck. Ripping or rubbing your neck back, rubbing your neck behind the skin may boost your phrenic nerve. Number 12. Poke the back of your throat with a cotton swab. Put a cotton swab back on your throat, swab the cotton swab back softly until you gag or cough. Number 13. Approach something attractive. Play your video game, fill in your jigsaw puzzle, or make certain calculations. When you stop concentrating on them, hiccups often go their own way. These tips are meant for short bouts of hiccups. If you have chronic hiccups that last for more than 48 hours, talk with your doctor.